When I started out my training, just getting the diagnosis of glaucoma was a really tough thing. So there was a lot of people on glaucoma medication that really didn't even have glaucoma. When I use the ZEISS technology, I can intervene at a much earlier stage, get people off their medications, and improve their quality of life. I'm Dr. Stephen Vold from Vold Vision in Fayetteville, Arkansas. I'm a glaucoma subspecialist by trade. I was the chief medical editor of Glaucoma Today for 7 years. I've been involved with many of the clinical trials on minimally invasive glaucoma surgery, so that's been kind of my passion throughout my career. We have a very broad anterior segment surgery scope of practice and really are kind of known for taking more care of more complex problems in glaucoma and cataract. We have something called the 20/20 experience. For us, it's all about giving people the very best vision we possibly can. Quality of life is a very big deal for us. Number one, we're going to try to get you off your glaucoma medication. You want to have your glaucoma well controlled to make sure that there's no progression. Second thing, I want to make sure the ocular surface is absolutely pristine. Glaucoma medicines are notorious for absolutely making people uncomfortable, irritated, red eyes. It can actually impair the quality of your ocular surface and decrease your vision. And then the third piece of that puzzle for us is correcting your vision to 20/20 or better. Glaucoma is the leading cause of irreversible blindness worldwide. Over 50% of people worldwide that have it don't even know they have it, so it's a real problem. By the time they have any symptoms at all, they may have 80 to 90% nerve damage of their optic nerve. It's very sneaky. By the time they know there's a problem, you've already missed a real opportunity to give them the best care. If we catch it early, then we can actually, believe it or not, treat it physiologically to get people off their medications, improve their vision, and really give them a whole lifetime of good vision. If I've got somebody that has glaucoma and I know I would like to get them off their medications, what's the next big question? Do they have a cataract? And the reality is when people are in their 50s and 60s and older, almost all of them are going to have some degree of cataract. They come in, they have their glaucoma treated, and the day after procedure, a lot of these people are seeing close to 20/20 or better without glasses. They aren't just happy, guys, they are ecstatic. This concept of interventional glaucoma therapy, combining it with cataract surgery, especially in that early to moderate stage disease, to me is a big deal. Well, how do we know which procedure actually works best for each of these patients? In the past, it's just been kind of blind luck if you get it. Now, I think with the newer technologies that ZEISS is working on, we can literally evaluate the collector system before we do the surgery that allows us to really select the best surgery, but then also better placement of particular stents and how we perform our surgeries. Jane came to me with a diagnosis of open-angle glaucoma and a cataract. Referred to me by another optometrist. She's in her 70s, she's on multiple glaucoma medications. They're irritating to her, they cost too much for her, so she's really liking to get off the medications. And then one of the driving forces for her is, man, I really want to see better. On our preoperative visit, one of the things that we do, of course, is we want to confirm the diagnosis. When anyone comes in, I don't just take everybody's opinions before. I want to make sure it's my own as well. I always like to do an optical coherence tomography screen. So we look at both the optic nerve and the retina on every one of these patients. I do gonioscopy. We look at corneal pachymetry, so it's very important to know the actual corneal thickness so we get the most accurate pressure reading we possibly can. And then, of course, visual field testing is another big piece of this. Glaucoma Workplace is a magnificent platform for allowing us to really put all the pieces together. We can detect these minor changes and small changes at a much earlier place than we have in the past. What you're going to be able to say, well, if I do this treatment, this is going to be the typical result with this kind of patient. We can be very confident of our diagnosis and then also be better in our treatments of our patients. When we know that there's a cataract, obviously we're going to need to do cataract testing. Looking at the topography, I want to make sure there's no ectasias. And then, of course, getting the lens measurements. We're looking at the IOL Master 700, making sure we have the proper axial length, making sure the macula looks pristine, we're using the proper measurements. We know when you combine angle procedures with cataract surgery, they tend to do extraordinarily well. And almost always, you're going to get a lower pressure when you combine the two. So it's a win-win situation. One surgery, a better outcome. So in early to moderate glaucomatous disease, that's what I want to do. And we're going to remove the cataract, which will open up the trabecular meshwork to some degree, but we're also going to show you the value of intraoperative OCT here today by opening up Schlemm's canal and improving the outflow. So capsulorhexis. One of the things I just love about the ZEISS Lumera and Artevo technologies here is we have unbelievable visualization, and for somebody who's 6'4" like me, it's really much easier on my back and my neck. From an ergonomic standpoint, just much easier on me physically. I do about a 5mm capsulorhexis, and then we do hydrodissection and remove the cataract as efficiently and as quickly as we possibly can. Good cortical cleanup and having a clean capsule is very important to me. I put a cohesive viscoelastic into the capsular bag, put the lens within the capsular bag, and we put in a toric lens. She had a significant amount of astigmatism. And then the other thing we did for her is we opened up her angle using a goniotomy procedure. To me, the intraoperative OCT part of what ZEISS offers is really unique, especially when you're using some of these stents that go into the subconjunctival space. It's remarkable. You can actually see whether the stent is buried in tenons. You can actually see where the stent is if there's a little subconjunctival blood. I did at least 4 to 5 clock hours of opening up that angle. We saw the blood flush into the anterior chamber. At that point, I will remove the blood, the viscoelastic. I also pressurize the eye at the end of the case. So now I have this ridiculously quiet eye with great vision. Pressures are improved, and the patient's thinking, wow, I had no idea that this was possible.
I'm so proud of you. You did amazing.
Good.
Wasn't too bad, was it?
No.
I expect this patient to do extraordinarily well, and you could see how happy she was in the postoperative area.
Well, you were a perfect patient.
Yeah, right.
We'll be checking up on you tomorrow to make sure that everything is okay that way. Surgery could not have gone more smoothly, and my hope is that we can not only improve your vision here, but get you off your glaucoma drops and really stabilize your glaucoma.
That would be fantastic.
As well as restore your vision from the removal of your cataract. So this is an exciting day.
You bet.
Charles came to me with decreased vision, and he was someone that was predisposed to angle closure glaucoma. What was his big concern? It was the glaucoma issue. But he also said, hey, listen, I'm just not seeing nearly as well as I'd like. He had a significant cataract. So we're not only able to help him with that, we're improving the quality of his vision and ultimately his life. The question is then, what kind of procedure do I do for him? Well, there's a study called the EAGLE study that really showed that if you use cataract surgery alone, these patients do extremely well. And so for people like Charles, I don't do very many iridotomies at all these days. Why? Because cataract surgery is so good. I like to go into the eye as few times as possible. The more ins and outs I go, the more likely there's going to be trauma to the iris. I go in, I break the lens into halves as you saw here, and I'll use that second instrument just to make sure it holds back anything here, just to guide the lens fragments into the anterior chamber. Again, use that polymer tip to really clean up the posterior capsule as well as the anterior capsule. And then I inject that lens into the capsular bag and dial it into position, and then use the viscoelastic removal using automated irrigation and aspiration.
One of the things that's really, really nice about the ZEISS QUATERA unit here is it allows us to remove cataracts in patients with shallow anterior chambers.
The ZEISS QUATERA has been almost transformative in how I do cataract surgery. I can track the intraocular pressure throughout the procedure. I can stay almost entirely in the middle of the eye, away from the cornea and away from the posterior capsule, so the chances of having complications are extremely remote. It's an exciting thing to be able to offer that kind of precision in surgery.
Their lives. Well, Charles, this just went perfect. You could not have been a better patient.
Just having come out of surgery, this guy looks extremely happy. Within minutes after his surgery, he's almost 20/20 in that. I think he measured 20/25 today. And now, as far as glaucoma, no one's going to worry about that too much. Now, they'll still watch for it, and it doesn't mean he can't develop glaucoma down the line. It's always a small possibility, but the risk has been reduced dramatically. Tony's a very unique patient. He's got glaucoma that's fairly moderate. He hasn't lost a ton from visual fields at all, really. But he's on 3 glaucoma medications. He clearly has a visually significant cataract. But what also complicates him a little bit, he's got what we call an epiretinal membrane, or scar tissue on the retina. So the question is, well, what do you do with a patient like this? Well, I had to have a long discussion with him, about setting expectations. And someone like him, I've got to make sure that I set them appropriately. I'm going to tell him, hey, listen, I'm not sure I can get you to 20/20 uncorrected, but I do think I can expand the range of your vision. We've learned that certain lenses are better for certain patients that have maybe some retinal damage. We also know that this man may ultimately need vitreoretinal type surgery. In those types of patients, I prefer to use an acrylic lens, and in this case, a hydrophobic acrylic lens.
What we're going to do here, by removing the cataract, we're going to, number one, help him see better. But then the second thing we're going to do is we're going to do what is called a goniotomy, and we're going to open up the trabecular meshwork, increase the outflow into the collector channels, and my hope is that we can get him off at least 1, 2, and possibly all 3 medications with this procedure that really will take us just, probably 5 to 7 minutes or so. This is one of the great things you're going to see by using the tools that ZEISS provides for us to give really just exceptional care to this patient. You can see here how the QUATERA just removes the lens nucleus. The anterior chamber here is stable throughout. It's just a whole new world of ophthalmology our patients get to experience using a lot of the technologies that are available to us. And at Affinity, you can also see how intraoperative OCT can really be beneficial here in our patients. You see how the blanching of the collector system out there, and you can actually see them dilating on the intraoperative OCTs. So it's kind of an amazing thing here. Clearly we've restored some of the outflow there just by the procedure that we've done here in just a matter of seconds. It's an exciting time to be an ophthalmologist, and I'm extremely grateful to companies like Carl Zeiss Meditech that really brings us some products that really are truly game changers in the care of our glaucoma and cataract patients.
We put a lens in there that's going to help him improve his vision from his cataract. The second thing we've done is very likely reduce his dependence on glaucoma medication and potentially significantly improve the intraocular pressure control he has, and hopefully that change the course of the glaucoma. And then on top of it all, I'm hoping that we can reduce the need for potential retina surgery down the line, because we're going to improve the quality of his vision. I derive joy in practice. It's not about a dollar bill, guys. It's about the quality of life for my patients. So I want them to have the absolute best outcomes possible, both on diagnosis and treatment. And for me, that happens with ZEISS. And so that allows me to go to sleep at night and know that I can be the happiest doctor on the planet.